Ladies and gentlemen, World Hypertension Month alerts all medical practitioners to the importance of proper diagnosis and effective treatment. In our commitment to public health and professional service, IPCA proudly presents a daily take-home message throughout this month. These insights are provided by the eminent Padmashri Dr. C. Venkata S. Ram, a global legend recognized for his pioneering contributions to our understanding of hypertension. Listen to Dr. C. Venkata S. Ram's today's message.
Greetings to my fellow medical practitioners all over the country. In connection with the World Hypertension Month of May, the message for today is about beta blockers for the treatment of hypertension. In the last few messages, I talked about general treatment of hypertension, and in a couple of messages, we talked about the role of diuretics in the treatment of hypertension. In another message, I talked about backup drugs for hypertension. Today, I'm going to talk about the role of beta blockers in the treatment of hypertension. For Indian subcontinent, I strongly believe beta blockers are useful antihypertensive drugs for the treatment of hypertension, especially in patients with previous cardiovascular disease. There has been some controversy about beta blocking drugs in the past, but that controversy is essentially due to atenolol. So, in my opinion, it should have been called atenolol controversy, not beta blocker controversy. But studies have shown that atenolol does not offer any cardiovascular protection. And that unfortunately became a beta blocker issue. It's not a beta blocker issue. It's an issue mainly with atenolol. But if you remove atenolol from the beta blocker group, then the other beta blockers, such as metoprolol and bisoprolol, are not only quite effective, but they have been shown to cardiovascular benefits. So, in the current paradigm of choosing beta blockers for the treatment of hypertension, one should consider opting either for metoprolol or bisoprolol as the beta blockers of choice. Not only they're effective in the treatment of hypertension, but they have been shown to provide cardiovascular benefits. They have a long duration of action and they're highly cardioselective. So, in summary, then, the beta blocker choices in the treatment of hypertension at the present time have been narrowed down to so-called cardioselective, safer beta blockers, long-acting beta blockers with effects on target organ protection. And at least two beta blockers fall into this category, namely metoprolol or bisoprolol, based upon the clinical evidence that is available at the present time. So, in summary, ladies and gentlemen, it has never been a beta blocker controversy. It has only been atenolol controversy. But if you remove atenolol from the group of beta blockers, then you have good choices that I mentioned earlier, either bisoprolol or metoprolol as a beta blocker in the treatment of hypertension, especially in patients with cardiovascular disease, either as monotherapy or as a part of combination therapy.